Today is Wellness Wednesday, and this morning we're talking to Dr. Brett Walker, an orthopedic spine surgeon at Memorial Healthcare Center for Orthopedics. We're talking more about diagnosing and treating spinal disorders. Good morning.
Good morning.
Yeah, thanks for coming in. Tell us a little bit about the types of spine conditions that you typically treat.
So as a spine surgeon, we treat conditions of the cervical spine, which is the neck, the thoracic spine, which is the mid-back where the rib cage is, and the low back, which is the lumbar spine. We treat everyday back pain, neck pain, but also traumatic conditions like broken bones or fractures and disc herniations. Most commonly, we treat a condition called spinal stenosis. And spinal stenosis is a condition where the area of the nerves is more narrow than it should be, causing symptoms for patients.
Yeah, so talk a little bit more about those symptoms. What are some of the typical symptoms of a spinal condition?
So with spinal stenosis, patients can expect numbness or tingling in the arms or legs. And so conditions of the neck will generally cause problems with the arms, and conditions of the mid-back or low back will cause problems with the legs. Most commonly numbness and tingling, but also shooting pains like sciatica, or even if it's bad enough, it can cause weakness.
Yeah, that's no good. I mean, talk about just the importance of the spine itself. I mean, it's crucial to our everyday life.
Yeah, absolutely. It is. It helps support our body, our everyday motion. So good posture, good spine health, core strength is critical to making sure that the rest of our body mobility is up to par.
So say someone comes to you with some of those symptoms you mentioned, you figure out what is the best course of action. You know, what are some of those treatment options?
Right, so patients will be happy to know that the majority of people that we do see in our clinic don't ultimately have to have spinal surgery. We oftentimes will start with things that are non-surgical, like physical therapies, medications, and also sometimes injection therapy that can really help to improve a patient's quality of life. Now, if those things don't work, surgery is oftentimes an option for patients to return to normal functioning, improve those symptoms that we talked about, and really improve their quality of life.
Yeah, so from the surgery side of things, what is that process like in the recovery?
So individual surgeries for different conditions vary, and so there's oftentimes a spectrum of those types of things that we'll do for patients. But what patients may not know is that many of our surgeries have become increasingly more minimally invasive over the last decade. And what that means for patients is generally outpatient surgery, so no long hospital stays, shorter recovery, smaller incisions, and all that leads to them getting back to their normal activities sooner.
Wow, who would have thought in this day and age we'd be talking about outpatient surgery with things related to the spine?
Correct, yeah, it's really come a long way in the last 10 to 20 years, and we're seeing more and more of the things that used to require lengthy hospitalizations now done when patients go home the very same day.
Wow, and then just finally, fill us in and give us a little insight. Why are you so proud of what you do, and why do you like helping people with their spinal health?
Well, I'm really happy to be here in town at Memorial Healthcare because there wasn't a spine surgery program at the hospital before, so patients in our community had to go elsewhere. And so I'm really happy and really proud to be at Memorial helping the patients in our community so that they can get that high quality spinal care right in their own hometown.
Yeah, so you're in good hands here with Dr. Brett Walker. Again, he's an orthopedic spine surgeon at Memorial Healthcare Center for Orthopedics. Here's more information on your screen about memorialhealthcare.org, where you can find out more info and a number to call. Thanks so much for coming on.
Thanks for having me.
Yeah, we appreciate it.